All right, so when it comes to diet, avoid processed foods.
Yeah.
We want whole foods, real foods, ancestral diet. But let's get more detailed on this and talk about specific foods we want to make sure we're including that are good for the oral health. And then, other than processed foods, other ones that are problematic.
Okay. Avoid processed foods. It's just too soft. They're lacking nutrients. That is clear. By processed, I mean refined flour, refined sugar. You know what I mean? Like wheat, bread, all the stuff that we always eat all the time. Convenient foods, basically. So the first question was which foods to support your microbiome and your teeth. Is that correct?
Yeah, a little bit more specific. We've
Yeah.
talked about it from 30,000 feet out, but coming
Yeah.
in more detail. And you could even use yourself as an example. What does your diet look like to support your oral health?
Also, we have to think about eating and chewing. Chewing trains your teeth, your bone structure underneath, and your jawbone muscle. These muscles, they don't come by eating soft food and eating and drinking smoothies all day long. So literally you have to also think about chewing. So let's say think in nutrient dense foods, stuff that we would have eaten for 2.5 million years. And you know that only within the last 10,000 years, we even started agriculture. So whatever you can fish, hunt, gather is usually quite fine. So I'm a big fan of meat, fish. I'm always caveat. I'm always eating healthy, organic food. Usually, I get my meat from local farmers. I don't buy any, let's say, mass-produced stuff. I mean, that should be a disclaimer here that I'm talking about good quality foods. But then I would say it's meat, fish. It could be anything. Could be nose to tail if you like to eat organs. I personally like to actually eat more leaner meats. I'm not a fat eating guy. It's not good for me. Not good for my health. It doesn't work for me. I'm more like a carbohydrate person. I'm a sports guy. I'm very athletic. I need a lot of carbohydrates. But I would rather eat like sweet potatoes or even some rice, maybe. But I feel like if you go with real whole foods, you cannot do anything wrong. Also goes for if you're dairy tolerant, obviously you can eat raw dairy if you tolerate it. I mean, that could be an immunological trigger. Definitely, if you had a lot of conventional dairy in the past, could become allergic to your immune system. But if you tolerated it, then raw dairy might be a good option too. So eggs, meats, fish, like the complete basic real food. It's so simple. Almost nothing that it comes in a package. Stuff that you could, like I said, hunt, fish, gather, or even collect. Fruit is amazing. It's natural fiber. I personally also, if that's interesting for you, for me personally, I see nutrition and food as information. So in everything I teach, protein is a very important thing because we need it as a building block for your teeth, for your bones, for all the surgeries we're doing, but also for overall health. So protein goal is always there. So I'm obviously focusing on having protein with every meal. Personally, leaner meats, fish, eggs, very simple. One information, meat is one information. And then I usually combine it with some sort of a easy to digestible plant energy source for me. Personally, would be potatoes, sweet potatoes, white rice even, just as a simple energy source. And I like to eat fruit. That's for me a lot of fiber, like berries, raspberries, for example, have a lot of fiber. Because personally, I'm not a big fan of, let's say, vegetables and greens and all these things. I can eat them. I feel like I more got used to them because I think they're just healthy for me, giving a diversity to my microbiome when it comes to fiber. But naturally speaking, I probably wouldn't touch too much. I would never eat any greens as a kid, for example. I wouldn't even think about it. But fish, rice, meats, eggs, that's good for me personally. But I've developed something that's called the food design protocol or food design concept that all my guests that come visit us start before they see us. Like 4 weeks in advance, we prepare our patients, we call them guests, on their journey to optimal health so that they come in boosted. And it's based on 20 years of basically testing every diet out there that you can imagine: keto, paleo, fasting, low carb, high carb, vegan, you know it. Like there's so many names for diets and they become mindsets. But the food design concept works as an umbrella above everything. And I teach my students also how to think in nutrients. So I've created my own algorithms for the average person that sees us on how to optimize their whole body starting in the mouth, because it's not just the dental stuff that we need to take out. It's also the food and the nutrients and the information we take in on a daily basis. So it becomes like a manual for a sustainable life, because I believe that nutrition is the foundation of everything, the motor, the food is medicine principle. And then from there, we refine and go into micronutrients. And I've created something called the bone healing protocol. That's also, it's way more evolved than a bone healing protocol, but it started as systemic bone healing. Now it's more like a complete functional medicine health matrix that is very simple, based on, again, the most important micronutrients, how they work in synergy to create hard teeth, hard as stone, healthy pink gums, and an amazing bone structure and good gut system, because it's all there. We just start in the mouth and then optimize the overall body from there.
So the way you explain food there, it's clear you're supportive, at least for yourself, including carbohydrates, things like sweet potatoes, rice, berries. Talk about how they act differently in the mouth, and I'm assuming that because you do support them, versus something like a cracker or candy, where depending on who you talk to, they could lump those both into the same category of feeding the bacteria in your mouth, leading to dental decay. So talk about how you look at that.
Yeah. For me, protein is the building block, right? And the other two macronutrients are carbohydrates and fats. So we know there's a lot of talk about, is carbohydrates bad, is fats bad? And some believe we just have to extract carbohydrates completely because they are insulinogenic, they produce a fatty body, and so on. And I agree partially. There are many guests we're seeing that we put on a phase 1 protocol, which is very, very low carb, just to reset everything, get the insulin sensibility back, get the blood sugar stable again. So I'm very, very well aware of that. I was just talking about me personally. I'm very athletic, have a ton of muscle. And for me, my preferred fuel is just these carbohydrates. And therefore I choose, let's say, smarter carbs that come in nature, because basically carbohydrates is natural, is plants' energy source. Fats is more the animals, how we us personally store fats, right? Energy. So if you throw carbohydrates all in one box, such as, like you said, the crackers and all the refined stuff, this is a completely different reaction to how the body deals with these nutrients. So if you eat a cracker, it's basically like drinking a Coke or eating pure sugar, because it's so refined. It starts in the mouth with digesting it. It actually dissolves in your mouth already if you put the cracker there. Then the wrong bacteria will eat it, produce more acid there already. But also, when you swallow it, within a couple of minutes, your blood sugar level rises a lot, like drinking a Coke. Sugar levels goes up. You need to produce a lot of insulin to get that out of, and then you get these blood sugar spikes all day long. And those in itself, like blood sugar spikes in itself, will throw off your mineral balance, will throw off your saliva, making it more acidic. You replenish less good. So we have to get the blood sugar stable. So therefore, we have to become carbohydrate tolerant, of course, first, and then the crab stuff, the crab food that raises your blood sugar blood sugar level, like classical sugar, which is the grains, the crackers, all these things. I wouldn't qualify them as natural, real carbohydrate sources. Those are just designer foods. They taste maybe amazing. They feel good in your mouth. They're designed to make you addicted. I mean, there's a whole host of chemical engineers behind all these things to make it even sound the way you love it as a consumer. So, and if you eat a sweet potato, for most people, they're not even enjoyable. Some call them vegetables. Yeah, for them they're vegetables. Potatoes are vegetables. For me, that's already a carbohydrate because it's a little bit starches. But if you eat them slowly and they have maybe even their skin on, you actually get a lot of fiber. So it takes your body a little bit longer to break it down, and you don't have as big of blood sugar spikes as you would have with like faster foods and more processed foods. Meaning the body's ability to stay balanced from and the mineral balance from the blood sugar, but also from then the saliva is completely different. It's just a completely different way. Same for sugar. Again, we should never eat fruit because then you're going to get diabetes. That is completely bullshit. That's complete wrong. Fruit, I feel like fruit is a way how I think we evolved eating sweet stuff. I teach my kids that superheroes, sweets are fruit because they obviously grow naturally, and I think this is what the plant gives you to eat and digest. It's easier to digest, has a lot of fiber. But if you now start to do smoothies and you drink 5 fruits in one little tiny glass, it becomes completely different. You might overload your body with too much fructose. Again, we are at the beginning of our talk, where it's again nuanced in the amount that we eat. So I personally feel you should never ever eat. Oh, I mean, you can do a smoothie here and there, no problem, but you shouldn't do too much of it. Like a couple of fruit per day, like 2 to 3 pieces, probably not a problem if you eat it in a whole setting, because then it comes with the fiber content, it comes with other micronutrients, and there's or honey. It has been shown to, even though it contains carbohydrates, technically, it has been shown to sometimes even reduce blood sugar levels. So I think nature has it right again. And just because it says calories and carbohydrates on the back of your labeling, it's not the same. That's again what I said a couple of minutes before. For me, nutrition is information. What information does your body get? And I'm sure your body inherently knows the information of a banana or papaya or some berries and what to do with it more than a cracker, a fish cracker, independent of the fish cracker sticking in your teeth and producing acids there from the microbiome. So that's, I think, the nuanced way to see it. But again, high fructose corn syrup is nothing from nature. That could be even more tremendous for your health. And I think this is something there is no healthy alternative for. Just skip that completely. And it's just super unhealthy.
I just want to make sure we fully parse out this piece before we move forward, where we can use the banana example. And I just want to stick to the mouth, where say we have a banana and the microbiome there starts to digest that, making the mouth more acidic and putting us into the demineralization state in the mouth. How does that differ for you compared to crackers or candy when we're talking about fruit like berries and bananas, sticking to the mouth again in the microbiome and how they react to that?
Yeah, I think the microbiome, it's just the bacteria. I think it's also the bacteria in itself, the same way as I explained the host. The way we digest the fruit is a different way as we digest the crackers. The same happens on a micro level for the bacteria. If the bacteria, the fast food, the ones that love the fast food win. So they get overpopularized, and they are the ones producing actually more acids, like Streptococcus mutans, Porphyromonas gingivalis, the usual suspect when it comes to tooth decay. Versus, you feed a complete different microbiome if you focus on eating fruit, because even these bacteria, maybe the bad ones, they don't even like fruit. They don't know how to digest it because there's fiber in it. They just shy away from it because there's polyphenols and all these other nice things in there. So it's a complete different set. It's like, I would say it's just, see the bug or like the microbe, the same way as us as a host, but in a micro environment, just doing it all faster because it's so fast in there. So if they get fast food, they might be able to produce their stuff faster, and you feed the wrong guys there. Parasites, for example, they love fast food. That's why sometimes you I have a lot of guests or patients that came with addiction to sugar. They have a sweet tooth. They cannot change it. Obviously, because of the sweet tooth, they also have very bad, poor oral dental repair work. And funny enough, sometimes when they come in and they have the health optimization week, we change the complete old dental repair. No more metals, no more root canals, no more inflammation in the jawbone. They report back that they don't have a sweet tooth anymore. We changed the complete oral microbiome. All these viruses and candidas and mold and other fungi, they lived oftentimes in root canals and poor oral dental repair, like that has to be revisited. They are then gone. We change it to a more normal one, and then you're not addicted anymore. So it's all about your microbiome, which is obviously on your skin, in your mouth, in your gut, in your everywhere. Like there's all sorts of different ones, and you can change that completely. But you never can change your gut microbiome if you forget about the oral microbiome, because that's actually the entrance hall to the gut. If you see it as a hotel, it would be the lobby. So yeah, you have to see the full picture.
Okay, so what you're saying then, bacteria in the mouth are going to react differently to these different foods. And then when it's something processed like again, we can use the example of a cracker or candy, that's going to lead to the acidic environment, demineralization in the mouth. And then while we're on this, let's bring the other piece of acidity in the mouth where somebody can have something like a carbonated water, coffee, kombucha, and this is independent of the bacteria, creating acidity in the mouth, and again, bringing us into that demineralization phase.
Yeah, this is something that is normal. Whenever we eat something or drink a coffee or a tea or an orange juice or whatever, Diet Coke, it's all going to inherently give you an acidic environment. Sometimes even more acidic because, for example, fruit juice is extremely acidic. And a coffee too, like it goes below everything below 5, like the normal pH in the mouth is roughly 7.4, depending. For let's say for men is usually quite neutral. For women it changes with their cycle because everything changes in there in the 4 weeks. Even the saliva gets more acidic. And if you just drink more acidic stuff, it will go below 5. And below 5 is when we speak about more of a demineralization. That means we're losing a little bit more minerals than we replenish. But if we get a little bit of time in between and we have enough minerals and an overall balanced system, body, it just bounces back. Your saliva is just a miracle molecule that will just instantly replenish the teeth and remineralize them. But it takes, let's say, 30 minutes. If you obviously have a lack of nutrients to replenish, then that's not going to happen because then your saliva might not be the miracle water you need. It might be a dry mouth that you have and you don't replenish anything.
Now, good point. We don't want people to fear entering that demineralization phase.
No, not at all.
It's just making sure we're not there all the time. Somebody sipping on coffee all day long and sitting in that phase, you want to make sure you have periods where you go there and then you come back to the remineralization and have the balance.
Everything is about balance. It is also about balance if you say you indulge into a Coke every 4 weeks because you just love it. It's also fine. You won't die from it. You have to have fun in your life. It is about balancing. And obviously, let's say there's something I call that resilience window. So people are more or less resilient. Resilient means how much stress can your body still tolerate? And obviously, I see a lot of high performance athlete, and I also saw or see still a lot of super chronically unhealthy, chronically diseased people. So they don't have a big resilience mode anymore. So you have to do a lot of things to get them back into this balance so that they don't throw out. Because if you're in a phase where you like have to be afraid of every little food that you're eating, because if you eat, let's say, a fruit and you then have a digestive issue for days, then you're not resilient anymore. Then something is completely off. So you have to modernize or rebuild your complete house, your body again, so that this is not part of the future. So that's just a signpost. But I have a ton of these people. So that's why we always prepare our guests at least 4 weeks prior to, let's say, the removal of all the old bad dental repair, so that they really are resilient in that phase. And because we're doing then the dental part, like taking out the root canals, the metals, that is the biggest detox they're ever going to have. It's not the juice cleanse that is a detoxification. The biggest detox is taking out root sources of toxicity and of toxic burden that was installed. Because let's face it, you're not born with metals in your mouth or a root canal treated tooth. Those are things that were put in later, and you cannot biohack your way around this one. You have to get rid of this. And this is removing the source. That's literally going to be the biggest detox if done properly. And then obviously needs to repair it in a smart way. Ideally, you never want to see a dentist in the first place, because your teeth are hard as stone naturally. But if that ship has sailed. We have to have some strategies here to fix it. And then we never see you again as a dental patient, at least, or guest.
And we're going to go deep into all those.
Of
But I want to
course.
make sure we finish here before we get into that. Say you talk to somebody who is going to come and see you, and they're in that preparatory phase where you want them building up before they come and get a procedure done with you. If they're not resilient, what are the foundational pieces that you have them work on to gain that back?
In order to see us, the foundation is change their diet and nutrition completely with the food design concept and basically replenish macro and micronutrients. That's what we basically do to build them up first. Then we're already quite more resilient. Some people, 80% of all the guests we're seeing in my hometown are actually from abroad. They fly in from Japan, they fly in from America, they fly in from Africa, they fly in from everywhere. It's like a destiny journey. There's only a handful that come from close by that we literally can see and tell them, hey, for you, the preparation actually takes 8 weeks. So that's why we average it out to 4. If you're already super optimized, we have a lot of these guests too that are already on a perfect diet. They eat a ton of nutrients. They are already built. That is my ideal scenario. That would be me personally. If I hurt myself, I can be in a treatment tomorrow and my body heals. That is the goal there. Obviously, when you prepare someone for, let's say, an average of 4 weeks to that phase of healing, when they arrive, they are with us for like a week. And in that week, there is a part of the oral procedure where we remove the metal safely and take out the root canals very, very gentle and take care of all the inflammation. However, on site, we have a complete health optimization center or biohacking facility, like an oasis of health. We have everything from IV nutrition, laser in your vein, hyperbaric oxygen, what is in English? Hyper and hypoxia interval training. You name it. We have it all on site to mitigate and make that resilience frame even bigger so that you don't look like Rocky Balboa after treatment after procedure that we are performing here. The goal is always, if you come in and you had a lot of stuff done, you will have a museum of life moment that you will never think about a dental experience that you had in the past again, because we're not dentists. We're architects of optimal health starting in the mouth. And that is something that is not there yet. And obviously the future of biodentistry we're working on, let's say a Waldorf Astoria approach to how we treat our guests on their journey to optimal health. Again, we're starting in the mouth, but obviously optimize the whole system while doing that.
So we've covered the food piece, and the principles are basic: whole foods, quality foods, ancestral eating. If somebody's doing all that, are there any supplements you recommend alongside that to bring them to an even better place?
Yes, this is also part of the preparation. It's called the bone healing protocol. That is based on high doses of vitamin D3, because systemic bone healing and also obviously tooth repair, and there's a solid science behind it. And vitamin D3, let's say, is not really a vitamin. It's actually a hormone that is produced in natural sunlight. But I'm in Germany. There is no sunlight for 6 months of the year, so we have to supplement vitamin D3. Ideally, if we live in a sunny world, we could go out in the sun during the day and get brown skin and have a lot of vitamin D3 from that. Let's face it, even though in Summerland, most people are behind closed doors because they're working. So vitamin D3 is one of the critical things that we're also measuring. And I want vitamin D3 on the day of treatments above the norm. So it's not 30 to 60 nanogram, it's above 60 nanogram, or let's say in a nanomole range, it would be above 150 nanomoles. So there's 2 different ranges. But it's not just the vitamin D3. We need that to get calcium out of the kidneys and the large intestine into the bloodstream. But we don't want to have calcium bricks lying around in your bloodstream and then calcifying your arteries. We want to have that in your teeth and your bones. So we need cofactors such as vitamin K2, magnesium, zinc to activate something in the receptor, boron is super crucial, methylated B vitamins, biotin. There's a host of micronutrients. And because I'm teaching this for over a decade, I've created a formulation that is called Bone and Teeth in Europe. Full disclosure, I have 2 companies for one in Europe for over a decade, Subs Nutrition, and this is called Bone and Teeth. It combines the complete bone healing science. It's called Bone and Teeth, makes sense, right? Systemically, but we also have that for America, so that it's a one-stop shop, the invisible mouth guard, basically, on how to water your plant, basically. This is the nutrients that your teeth need to be hard as stone, as well as your bones. It's called Tooth Shield in the US, if I'm allowed to say, and the company structure here is Supreme Oral Health. Yeah, but that's just the formulation that I was intrinsically motivated to design over more than a decade now. And I just lately found I have a trademark name for the bone healing protocol, which is from 2014. So that's how long it's been there already. And obviously getting iterated every time, because I'm believing in version 2, version 3, version 4. It's always going to be developed. That's just my mind. I just love to develop things and create things that are needed for many, because of my teachings, because of seeing thousands of patients. It's a different approach, obviously, to just finding a product and selling it. This came naturally with everything. So, but obviously it's there, so it's also good maybe for a lot of listeners to know that it's existing and that it helps. There's some nutrients. Again, vitamin D3, K2, magnesium, zinc, boron, methylated B vitamins, biotin, and molybdenum, and other, let's say, more trace minerals are also in there. Vitamin B6, molybdenum, and manganese are very important too. So it's a very well-rounded formula. I personally have the issue that my hair grows doubled fast as it should. Same for nails, but that's the same science. Bone, teeth, hair, and nail are just kind of like a little bit of the same biochemistry around it.
Okay, you talked a little bit about building somebody up with these supplements prior to coming to see you. How different is that day to day versus in that period of time leading up to the procedures?
You mean day to day?
Like dosage wise, is it I assume it's part of maintenance too, to take these nutrients, but does it differ when you're going to come and see you to build the body up?
Yeah, to build the body up, there's just phase 1. It is just higher. It's just higher doses. So on average, it's about 20,000 IUs of vitamin D3 in that phase for 2 months, including all the cofactors. But maintaining it, or if you just need that generally because you just want to do something to have strong teeth, because everybody actually wants strong teeth, right? You don't want to see a dentist, because you have tooth decay. Then you just do the normal amount, which is about 3,000 to 5,000 units of vitamin D3 a day, like the regular maintenance. So you probably can, when it only comes about, it's only about literally teeth and your bones and gums, you probably just solid with that one single formulation. There's everything in it. Obviously not enough for a complete surgery phase, because that's just rebuilding your house. You need more. You need more workers. You need more wood. You need more cement. You know what I mean? You need to rebuild stuff. So obviously we have also more amino acids then. We have more collagen, more protein. But that's supporting the actual, let's say, surgery phase. But maintaining it is something that needs to be maintained. So you never want to go below 60 nanogram per milliliter vitamin D3 in a lifetime. You want to stay in the high range. But when you're there, it's easy to maintain.
Early in our conversation, you went through your morning routine and shared a couple of supplements there, methylene blue and aminos. Talk about those two specifically and why you include them.
Amino acids, obviously, protein is the building block of life. And the parts of protein, the tiny building blocks of protein are amino acids. I mean, we know there's essential amino acids, which are 9, that we definitely need to get from food. If you take them in a powdered form, it's kind of like better living through science, because you do not need to digest a steak to get your hands on it. You get them straight away. So it's just an extra delivery. But the way I designed it is it's not just essentials. We have a couple of others that, for example, are precursors to your neurotransmitters. You maybe heard of dopamine, acetylcholine, serotonin, GABA. And obviously amino acids, if they're formulated the right way, we have tyrosine in it and a couple of other things, they will increase your more productive side of things during the day instead of making you tired. So you can also use them to give you more energy. The formula I've created also has a mitochondrial complex in it. There's creatine in it. There's magnesium malate in it. and various different amino acids to support liver phase 1 and 2 detoxification, because mainly detoxing is actually amino acids, amino acid conjugation. So most people always think when they hear protein or amino acids, they usually think about bodybuilding and building muscle. But actually, it's your immune system first that needs the protein. It is your enzymes. It is 50% of your body's collagen. So a lot of it in your body is amino acids and protein and information, your neurotransmitters. And then the rest of it, if you have a little bit of a surplus, then your body will use it for your muscle. So you really have to have a lot. Otherwise, you will first obviously prioritize bodily functions. That's why at least we need to have 2 gram per kilogram ideal body weight. This is 1 gram per pound. And for athletes, sometimes that goes way higher, or after surgery can be higher. So it's a specific formulation that I've created also over years and years of trial and error and testing. And methylene blue is something I just usually do for courses. Let's say I do that 6 to 8 weeks at a time and then stop for the 6 to 8 weeks. Methylene blue is just, I would say it's like it is a antioxidant. It's redox potential. So it basically gives you electrons, which you need for your
Mitochondria?
Yeah, exactly. In the mitochondria, for the mitochondria to produce ATP, you need a lot of electrons. And basically methylene blue gives you this. On the other hand, I don't use it in my mouth, or like you see it with biohackers with the blue tongue and stuff. I don't want to use it for my brain. I use it for my digestion. So it's also very strong antimicrobial. It also kind of like balances your gut microbiome too. So I see it as a little bit of in this case, it's not a fish tank cleaner. It is more like a intestinal cleaner. And yeah, we scan a lot. We have a lot of data on site. So a lot of our guests oftentimes have a ton of oxidative stress. And this is just a super nutrient or super molecule to balance the oxidative stress.
Did you say you don't take it through the mouth?
I take it, but I don't dissolve it in my mouth. I literally drink it so that it goes in my gut. I'm not a fan of, sometimes maybe the troches are good. If you experience, for example, brain fog, or your brain is not fast enough, it's amazing for that too. My brain is working quite fine, so it kind of couldn't overstimulate me, so I don't like it. But I like it very much for my gut.
Got it.
And the overall antioxidation purposes.
Okay. Any other supplements you include? Fish oils? Basic things that are...
Fish oil for me is not really a supplement. Fish oil for me is a basic nutrition. So we always have about 3 grams during that phase of real triglyceride-based omega-3 fatty acids and a lot of phospholipids from that because of our cell membranes. We actually measured it in that week when guests are here. We measured something called the phase angle, which shows how stiff your cell is. You know, your cell is kind of like if you look at your cell on a microscope level, maybe it is, let's say it's just round and it has an outer layer. It's called a phospholipid double membrane layer. And oftentimes this membrane gets stiff due to toxins in there, making it more rigid, but also the wrong oils. You kind of need an oil change. So omega-3 fatty acids, if they're triglyceride based and clean, obviously, they help a lot. But also phospholipids on top help, like phosphatidylcholine. Phosphatidylcholine is amazing. So that's included in the protocol. Vitamin C is included in the protocol. We have a specific enzyme to include in the protocol. Collagen, I already told you, because collagen is 50% of your bone. 50% of your whole body structure is collagen, even more. So we use a lot of collagen for gut healing and oral health care, oral healing. What else in the protocol? A lot of things are just basics for me, so they're not even. Magnesium is something I don't even consider as a supplement, because it's just like basics. It is in all of these things. So yeah, number 1 for me is the amino acid collagen drink in the morning. The methylene blue is an extra one. The bone and teeth is something, or the tooth shield in America is something I do every single day, because it covers strong teeth, strong bones, strong gums, very strong hair, nails, and it also helps with sleeping. It's all the same biochemistry behind it. It's methylation. It's just a good, well-rounded formula that I personally just have it like as the way you brush your teeth twice a day. That's how I use this also every single day. It's a maintained thing. I also I want to have strong teeth all the time. Even though I eat superfood and real food, I know that the nutritional quality, the soil is not the same as it was before. And I'm also not always in the sunlight. So that's why I include this single one always. Methylene blue, for example, it changes. I don't do this year round. Yeah. I mean, you probably do something like omega-3 fatty acids too. I think creatine is something I just always have. It's in my amino acid formulation. It's in there.
If you enjoyed that clip, you're gonna wanna head over here and catch the full episode. I'll see you over there.
Everyone can call themselves a biological dentist. There is no trademark, no standard, nothing at all. We are changing the whole profession from us being a technician into a complete health expert for the whole time that you are wearing these fillings.